Assalamualaikum. My name is Kashafni, and the drug that I was given is Clindamycin. And here I'm going to present my assignment or presentation. Clindamycin is an antibiotic and it is used in many infectious diseases which are caused by gram-positive anaerobic bacteria, and it is also used as an alternative drug in the individuals who are allergic to penicillin. And the strains of bacteria against which this drug is used are Staphylococci, Streptococci, Pneumococci, and these strains of bacteria cause serious infections like skin, soft tissue, and respiratory tract infections. And the irrational use of this drug is this, that it's a broad spectrum antibiotic, so it should not be used as an prophylactic drug. It means it should not be used in any type of prophylactic treatment. Also, its irrational use can produce resistance against microorganisms. For example, in Peshawar, clindamycin is 24.8% resistant to NYRSA because of its irrational use. Now, its mechanism of action. The main mechanism of action of this drug is it binds to the 50S ribosomal subunits and suppresses or stops the synthesis of proteins. Also, its bactericidal or bacteriostatic action, it depends on the drug concentration, organism, and infection site. It have many side effects, and the main side effects which we have are as follows. In gastrointestinal, it can cause vomiting, nausea, abdominal pain, pseudomembranous colitis, and esophageal ulcer. Hypersensitivity reactions, it can cause generalized mild to moderate maculopapular skin rashes reported most frequently, and during drug therapy, urticaria as well as vesicular bullous rashes also have been observed. Watery or bloody diarrhea it can cause, also little or no urination can occur. In mucous skeleton, it can lead towards polyarthritis, and with intravaginal administration, pruritus, candidiasis, vulvovaginitis, and vulvovaginal diseases can be caused as these side effects. Its drug-drug interactions are, it can enhance the action of the neuromuscular blocking agents, as it has the neuromuscular blocking property. That's why it should be given cautiously to patients who are receiving such neuromuscular blocking agents. Clindamycin and erythromycin should not be administered concurrently as their antagonism has been demonstrated in vitro. Toxicity. The most common adverse effects that occur with clindamycin toxicity are GI or allergic, but there is no antidote for clindamycin toxicity, and the threat and the adverse effects which are caused in result of its toxicity can be resolved with dose adjustment or discontinuation of the antibiotic. Dose. Its dosing is different, and its dosing is done according to the person, age, and condition. In adults, it's given according to the conditions, like if it's serious infection, then it will be prescribed 150 to 300 milligram every 6 hours, means 4 times a day, or more severe infections, then it will be given 300 to 450 milligram 6 hours, every 6 hours. In pediatrics, it also given according to the condition, like in serious infection, it prescribed or given in 8 to 16 milligram per kilogram per day, which is divided into 3 or 4 equal doses. And in more severe infection, dosing that is done is 16 to 20 milligram per kilogram per day, which is also divided into 3 or 4 equal doses. In pregnancy category drugs, it occurs in category B, which means it does not associate with any congenital abnormalities. Also, there is no need of dose adjustment in hepatic and renal impaired patients. In geriatrics, we have to give this drug clindamycin very carefully. And while we are giving them, we have to monitor those patients, means those patients who are geriatric, for the development of diarrhea. And it should not be taken by the nursing mothers as it can cause potential serious adverse reactions. Its prescribed dose, the maximum prescribed dose is 4.8 gram per day. It can be given IM or IV every 6 hourly, and minimum 1.8 gram per day oral 6 hourly. Available dosage forms with choices are parenteral, means IM and IV are given for severe infections and endocarditis. Topical, in topical dosage form like cream, lotions and ointments can be given for pelvic cellulitis, acne, etc. Capsules are given for different bacterial infections. Available alternate brands are these, and among them, the most commonly available with low price is Dalsin C. Also, it has the patient compliance, and the most expensive one among these alternative brands is Benmoc. It has a high rate. It has a high rate of price, so patients mostly prefer to buy or purchase Dalsin C as it is commonly available. And its alternate choice of drug is erythromycin, which is given in 250 milligram to 500 milligram. It is given as an alternative of clindamycin in those individuals who have a history of gastrointestinal diseases or hypersensitivity. Now we have a case study related to my drug, which is clindamycin, and the case study is ST is a 19-year-old sexually active female with a previous history of a moderate vaginal discharge that has a fishy odor, most notable after intercourse. She has no complaints of vaginal pruritus or burning. On examination, the discharge appears gray, homogeneous, and notably maltose. A diagnosis of bacterial vaginosis is made. What is the appropriate treatment for bacterial vaginosis? We will discuss it, and what patient instructions it will explain when dispensing clindamycin cream. We also see this. So the subjective of my case study is the chief complaint was vaginal discharge with tissue order, and the history of the present illness is that ST is 19 years old, sexually active female with a previous history of a moderate vaginal discharge that has a tissue order and which is most notable after intercourse. And the medical history is that 19 years old female with a history of moderate vaginal discharge with a tissue order, and she has no complaint of burning or vaginal pruritus. In objective, the lab test that we usually recommend for the clinical diagnosis in order to confirm the bacterial vaginosis is that positive vaginal gram stain, for which we perform positive amine test or whiff test. In this test, we prepare our sample, and in that sample we add 10% KOH. In this reaction, a fishy odor is produced. Also, the clue cells, if observed, and if the number of white cells is many, then it represents that beside bacterial vaginosis, there could be another infection. In signs and symptoms, we have vaginal discharge of tissue order, and the appearance of the discharge is gray, homogeneous, and notably malodorous. The assessment that I have made is this: as these signs and symptoms are typical of bacterial vaginosis. By vaginal gram stain lab test, clinical diagnosis has confirmed that the patient is suffering from bacterial vaginosis, as vagina shows the overgrowth of G. vaginalis in vagina. Plan, I recommend, or I must recommend the patient that she should take metronidazole 500 milligram orally PID for 7 days. CDC approved topical recommendation is clindamycin cream 2%, 1 full applicator, 5 gram intravaginally once daily for 5 days. And SD is instructed to avoid using bubble bath or any other OTC vaginal hygiene products, and also avoid alcohol consumption during treatment with metronidazole and for 24 hours afterwards. Additionally, clindamycin cream is oil-based, so it may weaken the diaphragms or latex condoms. Thank you. It was my presentation, and these are the references.